Okay, so here's my favorite slide. Healthy practice. Women should have 3 to 5 orgasms before intercourse. In case you're not sure how, here's an idea for you. Oral sex usually does the trick. And so I have some data to help you understand why this might be an effective plan for health. The first one has to do with what I just said about needing to clamp down the urethra. So if you want to prevent a urinary tract infection, you do not want bacteria to be moving up the urethra and back into the bladder. Okay, we don't want that to happen. So, but you can imagine during sexual excitement and movement and all the things that go on there, there could be movement of bacteria in that area. So if you clamp down the urethra tightly, then that bacteria is not going to be able to move backwards. And in fact, then upon orgasm, we're flushing fluids the other way. So it's a win-win situation here to make sure that the urethra is clamped shut to prevent any bacteria from migrating. And so again, that's because thanks to the female prostate, or the other term for it, there's actually a few, but para-urethral gland, meaning around the urethra. Okay, so that's reason number 1. So if a woman has had plenty of orgasms before intercourse, then, again, in a heterosexual situation where you have a penis suddenly moving around everywhere, it's not going to be able to migrate any bacteria because it's moving around. The second reason that I would like to advocate for this practice is that in order for the vaginal lining to be protected from the abrasion that can occur is to make sure that it is fully lubricated, right? Now, lubrication happens actually in a number of ways. It seeps out of, it's like a cirrus seeping through the vaginal wall to add fluid. We demonstrated already a few of the glands. So we have the periurethral glands release fluid, as well as those greater vestibular glands. And again, the more orgasms that have occurred prior to intercourse, that means the more lubrication of that surface and the less lesions that you have, right? I'm sure that some of you are aware that some people can have intercourse even though one of the partners has a sexually transmitted disease, but nothing's transmitted. And we have other times where it is transmitted. And one of the potential hypotheses for why that occurs is that if there isn't enough lubrication, that there is then friction that causes lesions, meaning just small tears in the wall, and that now exposes the woman's body to whatever pathogens happen to be there. Okay, so in my opinion, this is a very important sexual practice. And it also makes women kind of happy. They're not going to complain about this situation. So it seems, again, like a win-win. Good for her health, good for her mental and physical health. So I'll keep trying to convince you of that more and more. If you read about this topic, inevitably you're going to come up with someone debating the G-spot. It's another, similar to the female prostate, there's all this debate about what is the G-spot, is it there, is it not there, why? And so anyways, let me try to give you some anatomy that goes with that. The G part is just named for, of course, the guy who discovered it. Right, okay. So we can skip that part, right, because people have loved to put their names on anatomy, but I usually prefer a term that's anatomically correct, because then it tells you something about where to find it, not just the name of the person who found it and named it the first time. Let me orient you to this picture, though. It might just take a second. Okay, so we're looking at a mostly sagittal view, meaning cut in half view to one side of a female. Again, it's a drawing. So here's the uterus, here's the cervix, and here's the vaginal canal right here. That would mean that this is the bladder up ahead, and then here we go. So here's the bladder, and here's the urethra. Okay, so what do we call this? There was a few different names already, but what was the name of the spongy tissue that's very much like the male's, that's wrapped around the urethra? So the female prostate, and again, also around urethra, paraurethral gland. So that particular gland also has nerve innervation the same way. All of the tissue that you see there that looks like it could be engorged with blood. All of that is tissue that also has nerve endings. And so the first suggestion that folks have about an experience that relates to a G-spot, and basically the experience is just that a woman would have a heightened sense of pleasure and orgasm when this particular area is stimulated. But the problem and the debate in the literature is that not all women experience this. And so then again, it goes back to like, am I okay? Is there something wrong with me? Why don't I experience this? And they found that some women, it's not on the anterior wall, which in this diagram is up, it's on the posterior wall that they experience that. But we also have another gland posteriorly as well. So if this is the vaginal canal, pressure anteriorly or pressure posteriorly, either of those could have a heightened sense of, again, stimuli and lead to a especially good orgasm because of that degree of nervous innervation in either direction. So they've started to figure out why do we have different women giving us different reports, and that's because, again, everyone's anatomy is going to be a bit different. So just to be clear, so that most people, when they talk about the G-spot, they talk about an anterior, which again this is lying down, so that's up, that in particular, that area has a heightened area of nerve stimulation and therefore positive response. Okay, so that's what's up with the G-spot, is just an area of heightened stimulation.